So today we'll talk about Parkinson's pharmacology. This is drug therapy that is designed towards increasing the levels of dopamine in the brain. The first drug we'll talk about is cogentin. Cogentin is an anticholinergic agent and it works by blocking acetylcholine in the brain. It is usually used with other Parkinsonian medications. This particular medicine, cogentin, is primarily used for to help control the symptoms, especially the tremors that are associated with the disease. Some of the side effects, if you think anticholinergic and think what that means, then your side effects go along with that, meaning they're going to be things like dry mouth, urinary retention, blurred vision, confusion, just for a few. The next drug, Requipt. Requipt is used often early as well as in late stages of Parkinson's. It is a dopamine agonist, which means it antagonizes dopamine receptors, which just means antagonist means you aggravated. If somebody antagonizes you, they have aggravated you. And so that's kind of what Requipt does. Mirapex is a very similar drug to Requipt. These are PO drugs, and the big side effects we see with them are GI things, nausea, vomiting, and also some dizziness we may see with a little bit of hypotension that could occur. Amantadine is the next one, Simitril, and it actually is an antiviral, usually seen with use in treating the flu. However, it is also anticholinergic, which if you remember back, cogentin, we just mentioned, was also anticholinergic. So we will get some effect as far as for the Parkinson symptoms like the tremors. So usually this is a drug that is only successful in use in this first 6 to 12 months of therapy, and then it tends to just lose its effectiveness. So it's usually used early on in treatment, and then it is generally replaced. Moving on to levodopa. Levodopa is kind of the wherewithal drug for the treatment of Parkinson's. When people think Parkinson's treatment, they think levodopa. It has been around since the 60s. It's been used successfully for a very, very long period of time. We've learned a lot about this drug as time has gone on, but it is definitely the drug of choice. However, early in therapy with this drug has proved that it really can't be given alone. So over the years, we have added carbidopa to it, and the drug name for those two, that combination of drug, is Sinemet. And Sinemet is it's usually, it'll be a combination, maybe 10% carbidopa with the rest of the drug being levodopa, or it could be a 25-75 mix. There's several combinations of it, but the levodopa is considered dopamine replacement therapy. If you look in your text, if you look online, you read about it, that is generally what we consider this particular drug. So Sinemet is the drug that we're talking about, and this drug acts to allow dopamine to stay in the brain. The big side effects with it are, of course, GI distress. We've talked about that with a couple already. So GI distress and that orthostatic hypotension. So when they stand up too quick or go to get up too quick, they'll get dizzy because their blood pressure is dropping. But even though we say GI symptoms, GI problems, it is best to give this drug. It has better absorption if it is given on an empty stomach. However, it could be given with food if the person does not tolerate it well. There is something called Parkinson's drug therapy. It's a phenomena that is called the on and off, on time, off time. And they talk about it a little bit in your textbook. You can go back and read over that. But Sinemet is a drug that has been very successful in increasing the person's on time, and meaning their time without as many symptoms while they're on this drug. It's worth mentioning that pyridoxine, or B6, we talked about that back in tuberculosis, if you'll remember, and thyrodoxine decreases in the system, decreases the effectiveness of the levodopa therapy. So you have to watch for that if the person is taking or has been taking any B6 type things. A last little side note If you're interested, there is a movie that was produced in around somewhere around the early 90s, has Robin Williams in it, a couple other really good actors. Of course, it's a little dated. It's called Awakenings, and it is the true story of the experimental use of L-dopa with a group of catatonic individuals that were hospitalized in the New York area. And the movie, to what I pretty true to fact about what went on. This drug had been very successful in the treatment of Parkinson's syndrome, and so this doctor that was treating these patients there that were basically all catatonic, left catatonic from encephalitis that was back in the, I don't know, maybe the 20s or somewhere like that, that he felt like that this drug could be the answer to or the fix for these patients. And the movie depicts what goes on when these patients are placed on therapy, and you can really see the side effects that happen when these people are on just the levodopa, and then that'll make you appreciate why we now have that combo drug in Cinemet. If you're interested in that movie, I do have a copy of it in my office. It is VHS, so you'll have to have a VHS player, but if you're interested, stop by, I'll loan it to you.